Okay, so we're going through palpation of the adductor group. So we're going to start by obviously introducing ourselves to the patient. We don't just lay our hands straight on. We'd explain the reasons why we need to palpate and the areas that we need to focus on. But basically, if we focus on anatomical kind of orientation, the first one that we're looking for is adductor longus. So if we get the patient to do a slightly resisted adduction, we should feel a major kind of muscle belly kind of jump up, kind of in along this line here. So that one is slightly more anterior, so that's going to be adductor longus. So we can feel that it's kind of a meaty sausage type muscle. If we go in behind that, underneath, we're going to feel, it's very difficult to feel, which is brevis. From there, if we continue down posteriorly, we should start to flick over a small shoestring. So that will be gracilis. So that's going to run down along here to pes anserine. And then if we go slightly posterior to gracilis, we should feel magnus. And we just double check that that's not our medial hamstring by asking the patient to flex the knee. And we can feel that, and we can see that medial hamstring is running along this line. So in here, we should be on magnus. So just relaxing there. So magnus is going to run along through this line there. So again, from anterior to posterior, so we have longus through here, and then posterior and medial to that, lateral, we should have brevis. Then keep continuing along, flick over a shoestring, which should be gracilis, and then posterior to that we have magnus, which we need to differentiate from our medial hamstring by using a resisted flexion of the knee. So it should run between gracilis, magnus, and that should be medial hamstring.